Welcome to Medicine Redefined, a podcast focusing on helping you reclaim ownership of your health. I'm Dr. Darsha.
And I'm Dr. Altamash Raja. We're your hosts, here to challenge conventional practices and uncover the stories behind pioneers shaping the future of medicine. Our conversations not only focus on the individual level to dissect common practices for health optimization, but also zoom out to enhance systemic change.
Join us as we look to break the status quo, move the needle forward, and put the health back in healthcare.
Dr. Sarah Weinstein, welcome to the show.
Thank you so much for having me. Can't wait to hear with you guys.
Yeah, super excited. As we were talking about, the kids are asleep. At least yours are, mine isn't.
Yeah.
So hopefully no interruptions for us. And this has been a long time coming. I have to give a shout out and thanks to our friend Vince for, actually, he doesn't even know this is happening. So I can't even say for connecting
We'll have to
us.
tell him tomorrow.
Yeah. We'll just send him the episode when it's published.
Yes.
But I'd like to start by introducing you to our listeners. And so why don't you tell us a bit about your background, your family medicine, sports medicine, lifestyle medicine, triple board certified, mistaken, right? Correct?
Yep.
That's amazing. Yeah, that's awesome. Has a nice ring to it. So tell the listeners a bit about your journey and what got you into sports and lifestyle and where you are today.
So as for the sports piece, I grew up as an athlete, played year round, played competitively since I was a young age, had my host of injuries and illnesses that sidelined me. And I knew that I wanted to, at some point, help athletes get through all the things that I went through and all the things that I dealt with. And so I had no idea how I was going to do that. And I went into college and I thought initially I was going to be a personal trainer. I majored in exercise physiology. So that kind of at least gave me a very open field to see a lot of different stuff in health and wellness. Started off and I was like, yeah, I'll be a personal trainer. I'm going to help people work out and stay super active. And then that transitioned into maybe being a physical therapist and then maybe being a physician assistant. And then junior year of college, my advisor was just like, you should just apply to med school. And honestly, I didn't even second guess him. I was like, okay, sounds good. And I was like, what do I need to do? Let me think about the prereqs that I need to do. And just started doing them. And I never really looked back. In college, I started doing some shadowing of orthopedic surgeons. And I was like, oh, great. I'm going to be the first female orthopedic surgeon in Delaware because at that time there were none. And the guy that I was shadowing was like, you could be this person. Just join our practice. You can be that. And I was like, yes, let's do it. And then went straight to med school after that and learned about the field of primary care sports medicine and just totally, I fell in love with it. I started finding kind of all these different providers in the field, learned more about the specialty, which I had never even heard of before, as a lot of people don't. And yeah, went through med school. That was my long-term game plan, but was still pretty open-minded about all the other specialties. I loved gen surge. I was like, oh, maybe I'll do gen surgery or maybe I'll do family medicine. That was the two things I was deciding between. And then I ultimately decided family medicine, which would pave the way to sports medicine. So did 3 years family medicine residency, went on to do a year sports medicine fellowship in Colorado, which was just the most incredible year ever for multiple reasons. And then came back to the East Coast and got board certified in lifestyle medicine 2 years into attending Hood. And that kind of brought me to what I'm doing right now.
You mentioned initially started orthopedics. What made you decide to go non-operative?
Yeah, I was shadowing an orthopedic surgeon for a while. So I spent almost a whole summer with him essentially. And I felt like I was getting bored by the end of the summer and we were doing the same procedures, which was super cool. Honestly, at the end of the day, I liked gen surge better than ortho because the cuts were bigger and you could see more in gen surge. And that was just a lot cooler to me than going in with the scope and doing kind of the same stuff every day. So I was like, all right. And then I loved the family care and talking to the patients aspect a lot more being in a primary care specialty.
Gotcha. So not a gamer. Arthroscopy is not your thing.
I didn't play. I grew up not playing video games. It was one of those things that it was one of those things that I asked for multiple years in a row. And my parents just happened to take a stand on that one thing. And till this day, I am terrible at video games. And so that could be a huge reason. I've never put those two and two together.
Well, there you go. So you mentioned after finishing up your training, 2021, right?
2020, I graduated fellowship.
2020. Okay. A couple of years into attending Hood. And now you're doing something cool called the direct specialty care model. Before we dive a little bit into that, I'm interested in learning about how you weave through the traditional healthcare system to get there. You've had a couple of gigs. You worked in private practice. Did you do any academics or like nonprofit hospital based? Okay, so you spent quite some time doing in private practice. I know you and I spoke offline and we were telling me about how you had an opportunity to build part of the business and grow, introduce new lines of service as well, which I'm excited to learn more about as well, how that made you a better businessman, better entrepreneur. So talk about that experience. And then if we could lead into what was that turning point for you when you said, I'm going to go into this model? Was it some pain points or was it something else? I'm curious.
Yeah. So, like you said, I came straight out of fellowship, obviously, like height of COVID. I was actually talking to a job nearing the end of fellowship, and then that place went on a hiring freeze during COVID. And then I ended up joining them anyways, a huge ortho group in the Northeast area. And it was honestly, it was an awesome experience. It was an awesome way to start my career just by seeing a higher volume. Obviously, like when you are a first year attending, you are like absolutely terrified and you're like, what am I doing? And why are people trusting me? And how am I making these decisions by myself aside out of fellowship? And I was in a group that was just so supportive and I was seeing the higher volume, but like I had all these colleagues around me, mostly all surgeons, and they were so incredibly supportive for like, any questions that I had. I would curbside them. I would bring them over, ask them about an MRI, an X-ray. And they were just so open. And I learned so much in those 3 years. I knew that kind of starting at that group was probably not my long-term life plan as a physician, just because like I knew the way I ultimately wanted to practice. But I think in terms of getting my feet wet and getting my practice started and seeing patients was a really awesome way to start. And I still talk to all those guys, which is even better. But yeah, and that was obviously traditional insurance based model. And then there was an opportunity that came up to join a predominantly PT group, but they had PT, OT, chiro, and acupuncture. And I was going to be starting their medical side of the practice. And I thought that was like the coolest thing ever to be in this multidisciplinary group and just all work together to provide patients with better outcomes and better care. That group was out of network. And so they already were a little bit different than the model I came from. So obviously I learned a lot about that too and understood what out of network meant. I literally don't think I even understood how that model worked when I came out of fellowship and started at my job, where it's just your typical insurance based model. So I learned about the nuances of that. And then I obviously learned a lot in the process about starting a medical practice from the ground up. But after a few months of being there, I think I was there for like 6-8 months, it just didn't serve me well in other ways. And I know myself, and to be in an environment that was not totally for me and was like taking energy out of me and like affecting other parts of my life, I was like, I don't need to do this, right? I can spend my energy elsewhere, like doing things that I actually love doing. And that's how I was just thinking to myself, like, what's that next step for me? Either I can go back to the big group that I came from that was super supportive and great. And all I had to do was start and the patients would just come. And like, I had to put no other really effort into it aside from seeing the patients. Or I just totally go my own route and start my own practice. And obviously I chose the latter. And that's how I decided I would start my own practice. And then I just had to figure out what model I wanted to adopt that would allow me to practice the way that I wanted to, treat patients the way that I wanted to, and just have the life that I ultimately wanted.
I love how you bring up energy, Sarah, because I'm a true believer in that it's never the individual's fault, but the environment that you put yourself into, right? And you're never going to succeed if you're in an environment that drains your energy. Now, as a rehab doc, I probably speak for many of us PM&R trainees, but even just a lot of pre-med students that think they want to do sports medicine, but then get to the point where they realize, oh, wait, I'm not just working with athletes all day. You know what I mean?
Yes.
And I'll admit, I was one of those people where I thought at some point I want to do sports medicine until I realized what it truly entails. Now, when you decided to transition to DPC, was it the field itself of sports medicine that you felt like it was limiting you, or was it the healthcare system itself?
The healthcare system itself. Yeah, I think from the sports medicine piece, I think sports medicine can operate fairly well in a traditional system, but you are certainly limited on how much time you spend with patients and what you can talk about. And so for me, like I love spending more time on talking about lifestyle and how this integrates with sports medicine, right? Knee pain is not just a knee, right? There are so many other factors that contribute to this. And to be able to like really talk to patients about this and explain how these different aspects of their lifestyle are contributing to their pain and the inflammation in their body definitely has its limitations within a traditional insurance-based system.
It's funny how I have regained an appreciation for sports medicine through that avenue, through lifestyle medicine,
Yeah.
through precision medicine, and then finding a way to tie it back to exercise physiology and whatnot. So
Yes.
yeah, the two go hand in hand.
100%.
Sarah, it might be worthwhile just educating the listeners on what out of network actually means. I think most people will probably be familiar with it, at least listeners to this show, but in network, out of network, what does that even mean?
Yeah, and so this is all insurance, all around insurance model, right? And so when you pay premiums for your insurance, whether that's through your employer or self-employed, whatnot, that insurance kind of dictates what providers are covered, like meaning in network, where you'll have lower cost fees up front, whereas out of network will typically be higher cost unless you have like specific coverage for out of network providers. And then obviously the direct care model is totally different than all of that. So yeah, it's just a different system that really just comes down to insurance.
Cool. So I think it's time. You highlighted how the direct care model is in its own entity, its own bucket, so to speak. So tell us a little bit about what direct specialty care is. DSC, Darsh, not DPC.
DSC. Yeah, it's funny also, Ash, because I think when we were talking offline, I don't know how long ago, but you were like, "Oh, you decided you were going to start your own direct specialty care," and I was like, "Sure, yeah." But I think when I decided to start my own practice, I wasn't like, "I am definitely starting my own DSC clinic." I was more just like, "I'm going to start my own practice. I'm going to practice the way I want to." But like, the way that I'm doing it is like, obviously very much direct specialty care, and like it's all together. So the direct care model really started as direct primary care. And this is an alternative healthcare model that completely takes insurance, that third party, out of the equation. And so patients are now paying their provider directly for the services that they're getting. And most direct care models are membership based, meaning that patients will sign up for a membership, usually on a monthly basis, pay a fee, again, directly to the provider for specific services that they will be getting. So obviously, like in a primary care model, they're getting primary care services and perhaps other stuff as well. For specialty care, it's very similar. A lot of them are still membership based, but now we are, whether you're an endocrinologist, whether you're a rheumatologist, and you're offering these specialty services, you can still offer these things and get paid either with the membership or just like fee for a specific service. But again, it is the relationship directly between patient and provider, right? So patients are never getting surprise bills from the insurance company and they're never getting surprise bills from my office. Pricing is like totally transparent. Like patients know exactly what they're paying up front. There's no copays. It's just much more personalized. And there's just more time and the ability to really talk about like prevention and wellness because you take away so much of the administrative burden when you are in an insurance based system, like billing and coding and contracting with insurance companies and needing like multiple staff members to do that aspect and reimbursements and whatnot. You take that away and you just have so much more time and energy and less stress that you can put that into like actually clinical medicine and having that direct relationship with your patients.
Yeah. No middleman, right?
No middleman, which
Yeah.
is, it's amazing.
You know what's interesting? I'm so excited that this term is available for us to use now, right? Direct primary care, direct specialty care, because it's been around for a long time, but people were just
Yes,
calling cash based practice.
right.
And it's interesting when you say that to people, it has like like a little grimy feeling to it almost.
Yes.
I remember
Yes.
talking to a prior guest here. I won't name her, but when I was asking her just some tips about, hey, I want to go into this, and she's been doing this for 25 years plus, and also in academic medicine at a very high level. Um, and one of the things that she said to me was, if you're going to be charging cash to people, a lot of your colleagues in the community are going to, they're going to look down on you, or they're going to think a certain way about you, which is interesting, right? Is we as clinicians, as doctors, we've been robbed essentially by the administrators who've come into medicine over the last 30 years and caused the healthcare cost to rise exponentially, even though physician costs. And this data is easily accessible for anybody on all social media platforms, that physician salaries have remained consistent, but the administrative salaries are just skyrocketing. And so when physicians wanted to break free of that, they use that term cash base,
Yeah.
exactly what you're describing.
Yeah.
Simple transaction like anything else in America. You go to a
Yes.
store, this is what much it costs. There's no bill after the fact. And so, yeah, I just wanted to put that aside. And now when you mentioned that, people are like, oh, okay, that seems interesting. That actually seems like a good thing. So words
Right.
are really powerful.
100%. And I totally agree. I think that you tell people that it's like you're going into this part of healthcare and they're like, oh, like you're just treating like super wealthy people, or yeah, cool for people that can afford that. But it's totally different. And I think a lot of people also lump this model into concierge medicine. And so I think when you say that you're like going off on your own and most of your services are cash, people are like, oh, so you're going into concierge medicine, which is not the same thing. And I think that is one of like the biggest myths about direct care, is that it's not concierge medicine. So yeah, because concierge medicine still charges insurance companies. They do charge patient also, but they charge insurance too. So they do still talk to them. Whereas direct care takes insurance completely out of the question.
Oh, see, I didn't know that. I thought concierge was closer to the direct model, but maybe another level up where, and I'm sure there's subsets to it. I know a lot of
Yeah.
people who are concierge and they'll actually do home care or be on a
Yeah.
retainer for the year and have some type of model like that.
Yeah, I think there's like within kind of like the alternative healthcare system, there are so many hybrid models that it's yeah, everything every place is probably a little bit different.
Yeah. So we're already touching on this, right? Some of the misconceptions about the direct care models. Anything else that is worth disclosing for the listener, for the learners today about other misconceptions of the direct care model?
Yeah, and I think also assume that direct care is going to be like really expensive. And I think the biggest thing, especially with like the DPC or direct primary care model, is that they are it's actually reasonably priced and not just for the super wealthy, that they're making this affordable healthcare for everybody. So I think that's another misconception. Yeah, I think direct specialty care, obviously not as well known as kind of like direct primary care, which is getting more and more. But I think direct specialty care, I think people are just like, can this be done in a direct care model? Can specialty care be done in a direct model? And like, why not? Right? If we can provide value and if we can provide answers to patients that just haven't found them yet and that are fed up with the current system, like, why can't we do this?
Sarah, can you touch a little bit more on this misconception about the quote unquote only the wealthy are paying for these type of services? Because that's a lot of the pushback I get when I talk about this to a lot of people. So is it the price point that's fair enough that allows people to pay for a subscription? Or is it where the location practice is, if it's telehealth? Like, how do you view becoming more accessible for everyone?
Yeah, I think it's price point in general. I think you'll see in like a lot of these DPC practices, which obviously like, are a little bit different, like their pricing per month for the membership model is like $99 per month, which like people are paying for gym memberships that are more than that, right? I'd say like probably most people these days. And they're so that I think is when patients like find that out, they're like, oh, that makes a lot of sense. My model is a little bit different because I'm not doing primary care. And right now I'm mostly just like fee for a specific service. But I think still keeping prices somewhat reasonable makes it affordable for everyone. And I think that when you take into account the value, I think that counts for a lot, right? And I think that if somebody has not found those answers, then they will be willing to pay for really valuable care.
Yeah, and I think like a really important distinction to make here is that it's an investment in your care. So that I'm glad
100%.
you brought up the part about the value. You know, when
Yeah.
people will at least if they're transitioning from the traditional insurance-based model where they might have had a $50 copay. I feel like that's pretty standard for a specialist.
Yes. Yeah.
And they're like, oh, it's a $50 copay, and you're getting maybe a total of 10 minutes, 15 minutes
Right.
after like the check-in process and everything going on.
Yeah.
You just feel like you're going in and out, and it's not a great experience. Versus, I sure the quality time that you're spending sitting down for 45 minutes, an hour, and really getting to understand the life story of that person and what brought them there. And as you mentioned, in the back of your mind, you're not stressed about the other administrative work that needs to be done and moving on to the next patient. And the volume tends to be a lot lower. And so as a human being, as a physician, you can give more of yourself. And so I think that's a piece that's really important for people to understand is sure, it might be 2 times or 3 times whatever your copay might be, but understand you're not paying a premium. So I don't know if I would suggest anybody trade off completely. I'm sure down the road you could do a DPC and direct specialty care,
Yeah.
which actually is interesting. Like with my current insurance, when I log on to my insurance portal, it's almost like they're advertising to me to go for a direct primary care models. So I find
Yeah.
that to really interesting, this phase shift that we're having in the current healthcare model, particularly with all the excitement over the last couple of months, couple of years.
Yeah. No, for sure. And I really do think that like we are starting very one small step at a time to transform healthcare and go towards these models because I think patients again are just not they're fed up with kind of the care that they're getting or lack of care that they're getting because as you said, right? The first practice I was at was 20 minutes for a new patient and by the time that they get back in the room, the medical assistant takes their vitals, gets a little history, does everything they need to do from an administrative aspect. We have what 5 minutes left to actually see them, and it's like, cool. Let's talk about what's going on in 5 minutes. And now it's like I spent an hour in my initial consult with patients, and I think the biggest feedback that I get from patients is they felt valued and they felt heard. And I think that is so important as a patient. Like we can obviously relate to that when we're patients ourselves or our family members are patients and you see the care that they're getting and you're like, oh my gosh, I can't believe that this is the way that the healthcare system is. And we're in healthcare, so we can be advocates for our family members and for other people. But to be a provider and now providing like that care is awesome. And I think it's so important and it's so rewarding also as a physician.
So let's talk about your specific model. You mentioned a variety of options that people will have. It could be membership based with a lot of primary care ones, cash based services, straight fee for service, or maybe a hybrid model. Anything else that I'm missing that, or is that
No,
pretty much okay?
yeah, that's pretty much it. So my model currently, since I'm like still in infancy stages right now, is still pretty much just like fee for service. I had when I was starting to look and starting my own practice, I had all these memberships lined up and it was like holding me back a little bit from actually getting doors open. And I'm like, let me just get the doors open. Let me just have a pricing structure up there that is reasonable. But I definitely plan within hopefully the next few months to roll out more of a membership model because I think, especially from a lifestyle medicine aspect, it just makes sense and offering more services to patients and really feeling like they are just getting a lot from you as a provider rather than just like paying a specific amount each time they come.
Yeah, Hormozy would be so proud of you. Don't just sit on it. Go get it done.
That's right. I just started reading his book. Love it.
Yeah, I saw you retweeted or posted something. Yeah,
Such
big
great
fan.
quotes. Such great
Yes.
quotes.
Yeah. Darsh and I actually we did a whole episode about him and some of the wisdom and pearls that he puts out there. Phenomenal guy.
So many. Yeah.
I'm curious to learn about as you were exploring, and certainly I think as physicians we're very cautious people. We're trained to be like that. Certainly practicing in this country, and if you've been trained in this country. So, what were some points where you really wanted to seek some legal guidance as you were setting up? Or if somebody who might be going into that, selfishly me, what advice might you give about, hey, here are the legal considerations you need to account for? And then I'm also curious, you mentioned pricing structure. Like, how do people go about exploring where to start? Because different regions will have different pricing structures, which are appropriate, right?
Yeah, for sure. Yeah, I think legally, like the first thing that you need to do is establish your practice as an entity, right? And so talking to a lawyer, talking to an accountant from the very beginning and deciding how are you going to structure your company? Will you be an LLC? Will you be an S Corp? Again, things that I have literally never thought about in my entire life prior to looking into starting my own practice. And then, so those are really important things that you want to obviously do. Probably that's the first thing you need to do. And then also getting your employee identification number, like your federal tax ID. That is so that you don't get in trouble with the IRS because none of us want that, especially when we're starting our own practice. So those are like two really big things from the beginning. And then like little things that just come up, like while you're doing that stuff, like the LLC or getting your federal tax ID, you have to have an office address. And that's where I was like, I don't have an office space yet. So I was like, what do I use as my address? I was like, I don't want to use my home address, obviously, but I like that just totally threw me off. And so I started just talking to people. And there are literally these virtual addresses that you can use, physical locations that you can use as billing address. And so that's just what I did. And it was easy, but like little things that come up like that you're like, never thought about that before, especially because I don't have an office space yet because I'm like still in the very early stages. But yeah, definitely lawyer, accountant, having them on board, establishing the structure of your company, thinking about all of the insurances that you need, right? As physicians, we always need malpractice insurance. So finding the right coverage for that, getting all these different quotes, talking to different people, seeing what they use, having general liability insurance for the office. Someone slips and falls, they sue you, then you want to make sure that you're covered for that. Just all these different insurances. Luckily, there's so many resources out there that have blueprints for starting your own practice and things that you need to be aware of into your resources. And like being a business owner, you have to be somewhat scrappy in the beginning. And so just trying to find all the different things that you can access without paying a lot of money is really important. And you find a lot, which is amazing, like things you have never heard of before. So those are all really like the important things legally, financially. And then pricing structure wise, yeah, you have to look at your current market and where like your actual zip code to see what the market is like there. There's something called Fair Health, and that is a website that you can put in your zip code and you actually see what typical reimbursement rates are like in that area for like typical in network versus out of network. I learned this at my other job because that's how we also like thought of our pricing structure. So that's one good thing to know, like, how do you compare to like your actual zip code, right? And then the other part is also just talking to literally anybody you know that has started their own practice and similar type fields to you and just like seeing generally what the structure is like. And some of it also trial and error, right? If you are like seeing that there's issue with things, like you can change. That's like the nice thing about having your own business. You can change things like if you need to. You can run promotions when you want to. This is like your game now. You want to have a good baseline and a good background for things that you want to be doing, and that you should really use like your colleagues and your resources. But the fair health thing is also really important just to know what reimbursements are like in your actual area.
Yeah, I think the full website is fairhealthconsumer.org, right?
Yes.
Yeah, I quickly popped this open and I think 64418, I think this is a suprascapular nerve block. Take a wild guess what an out-of-network uninsured price is, Darsh, in an ambulatory surgical center. I don't know Darsh, have you ever done an SSE, suprascapular nerve?
No, I've actually never done
yeah,
one.
in sports,
Actually, I might have assisted on one.
shoulder pain is something that we do very commonly, right? And take a guess. Price is Right rules.
I want to go with 230.
Yeah, 5,260.
I was going to say.
That see, and this is the nonsense.
Darsh, make sure you look at
this
add a
zero
starting.
at the end.
Yeah.
Yay.
This
I
is
meant to add a zero at the end of that. You heard me wrong.
This is why I recommend people check out the Marty McCary's book, The Price We Pay. And I became familiar with this website and a couple other ones that he mentions in there too. It's just crazy that now I'm sure if people see this and then they go and say, hey, I actually don't have insurance, can I get a discount? And they'll say, yeah, it's a 70% discount. Just like that, by asking discount, they'll bring it right back down to something more reasonable. Because you and I, like Sarah, we know we do this injection all the time. Like it takes us less than 2 minutes to do this injection. You set it all up. And we also know that the reimbursement for us is not less than a tenth of the number that I just threw out at you guys. Probably 1/20th or some version of that, right? And so it's this markup system that we have. I think I recently heard somebody talk about it. It's like the drug cartel operating in America, and it's scary. I forget who was mentioning it on the Piers Morgan show. But I digress. Let's come back to you were mentioning LLC structure. You were mentioning talking about lawyers and looking for talking to brokers about getting liability insurance. How did you go about shopping for a good healthcare attorney? That's what I'm curious about.
Yeah, luckily for that, sorry, my daughter's definitely awake. For that, we actually had somebody already that my husband's also a physician, and it was honestly a family friend who's a healthcare attorney, and that was just really helpful for us. But if I didn't already have that and like shopping around for accountants and other one, I just asked people. I asked as many people as I could to see who they recommended.
I'm curious about resources as well in regards to business. You mentioned Hormozy. We're all fans of him, but were there any other, let's just talk about websites, podcasts, books that have really helped you get better insight into being a better businesswoman?
Yeah, I honestly think that probably the most helpful thing, you guys have heard of SOME docs, like docs on social media, SOME docs. So and I like literally just happened to come across this on Facebook one day. They were having a webinar about how to start your own practice. And I signed up for it. It was like not that expensive. And I was like, oh, this could be helpful. This was like before I was considering starting my own, but I was like still at a prior job. And I was like, oh, let me see if this could be helpful. And there were tons of speakers from like lawyers to people talking about financial considerations to people talking about how to save your marriage while also starting your own practice to your own specialty care practice. And there were so many different speakers and it was so helpful. I just kept a Word doc next to it when I was watching the lectures and just like writing verbatim some of these things down. And that was literally my blueprint for starting. I used a lot of other stuff too. There was a podcast that a friend recommended, another sports med colleague, called the Private Medical Practice Podcast. I think it's like Sandra White's maybe. And she has all these little like 10-minute podcast episodes on different topics about how to start your own medical practice and things to consider, everything from EMRs to supplies to being out of network versus in network versus cash based, and how much staff to have and how to name your practice. And so all of these things that literally in 10-minute episodes. So I would go for like a 20-minute walk every day during the day and I would listen to like 2 of these episodes and they were just super helpful. So I would be like taking notes on my phone as I was going along too. And then again, colleagues, right? So I would find out people who started their own thing and literally like cold call them or email them. And everybody was so helpful. And I think that's what's so incredible kind of about this community and people going into the side of healthcare is like, they just want to help others who are trying to do the same thing. And they're so happy to share their stories, so happy to share like their trials and their errors and everything that they've done so far. And I think that's incredibly helpful too, because that's just ongoing support. And if you don't have that support network, it's going to be really hard to continue your own practice.
Yeah, for sure. That's obviously a misconception that people have too, right? Is that people who start these cash-based practices are selfish, but in the end,
Yeah.
it's actually selfless with the value you provide and how much help you would just want to give your colleagues. I don't know how much AI you've been able to use as well. I know it's probably been a couple of years now, at least, that you've been starting this, but now that AI is really taken off, I can let Altamash talk about this more than I can. He's a fanatic of ChatGPT and Grok now. Do you use
Yeah.
Alt or I don't know what you're using?
I honestly use every single one of them.
I would love to hear more about that. You can definitely give me like an offline lesson.
Oh yeah, no, we've talked a little bit about it, but I work with a lot of medical students and I will tell them, in fact, my resident who I was working with last week, he was telling me how he was struggling on some research that we're working on, trying to find some specific answers to some very specific questions regarding post PRP rehab. And I told him, I was like, you just go ask AI to do the work for you. In fact, Perplexity now has their deep search feature. It's just out of this world, the resources. And I even have it review my contracts. No, not telling people to do that. Find your attorneys, but
you got to tell AI to act like an expert lawyer.
Correct. Prompt engineering
That's the key.
is very important.
You got to prompt it right.
Seriously, Darsh, you and I were talking about masterclass. They actually have masterclass for this.
I'm sure.
Yeah.
Yeah, just make sure that you don't copy and paste your question in the prompt in whatever you're doing. So I feel like I've heard stories of that in people sending emails with like their
Mhm.
question and their prompts, and I'm like, oh my gosh,
Yeah,
rookie
with the
mistake.
advisor,
For sure.
advisor
Yes,
giving it to you. Yes,
Mm.
yeah, is very, very
Absolutely.
important.
yes.
Yeah. So let's talk about advertising and marketing. What has been your primary strategy? Actually, I'm curious, what was your initial strategy and how have you pivoted since you've been in business? We're coming up on 6 months almost. No, 5 months, right?
November.
I assume you started marketing prior to that.
Probably, yeah, maybe like
Probably.
October. I was in
Yeah.
my other job till September, so I couldn't
Got you.
cut it too close.
So tell me what you've learned, what's worked well, and I think people should be putting a lot of energy into.
Yeah, for me, the way that I started and the way that I'm still going is just getting out in the community. I keep an Excel spreadsheet of my marketing and divide it up between PT places, primary care offices, gyms, country clubs, like all the places that I'm going in different categories. But I'm just trying to go to as many places as possible that I think I could get patients from, and talking to them and introducing myself and telling them what I do, and marketing my brand and really just showing them what I am passionate about. And that's the best part is I am not trying to sell somebody else's services that like I don't necessarily believe in. I am just like telling them like what I am so excited to be doing and like how I can help people and just being my authentic self. And if they're like, oh, not interested, I'm like, okay, cool. Then I don't need to really be here. Right. But I haven't had anybody do that yet, which is good. But yes, I think just also finding out, like thinking ahead of time, who is your core patient base, right? And you need to think about who your ideal patient is before thinking about your marketing strategy because you want to be marketing towards those people, right? Sure, you want to be doing some general marketing and advertising and putting ads out there. But figure out who that ideal patient is and go towards them. So for me, like the small boutique gym type population is like my core patient base. And so I have been going to like gyms within, I don't know, a 15, 20-mile radius and have tables there just for like on a Saturday when they all finish up classes so people can come talk to me, like giving educational talks. Just getting out in the community, I think has been the most helpful thing because you're just out there as a normal person and people see you and you're not, oh, I'm a physician. Like you can't talk to me, right? Like you got to be able to talk to people and just be your true self and show them what you do and listen to their stories. So I think that has definitely been the most helpful. I honestly have not gotten so much into the paid ads and the Google ads and like stuff like that yet. I've done a little bit of that, but obviously there's so much more to do with that. For me, I've just been like getting out as much as I can because that I think has been what has paid off the most.
I love that. Outreach is such a underdeveloped skill and
Yeah.
has been something of the past almost, right? Like, everyone's so
Yes.
focused on social media now and just
Yes.
doing outreach through that.
Yeah.
Because that's where primary brand building is happening now, right? Everyone's
Right.
trying to become someone through that. But
Right.
take me through, how do you view social media? How do you view building your brand specifically so that people can find you without actually having to see you in person?
Yeah. No, I think social media is really important. And that is definitely something I am learning a lot about. And so, like, before I started this practice, had no idea how to create a reel. And I was like, I don't understand this. Like, how are people doing this? I don't know how to edit. I'm just not good at this stuff. And like, you just have to learn. Like, you just have to do it.
Mhm.
And yes, I am not like an influencer and I don't know how to create these incredible reels, but I'm at least like getting a little bit of content out there and just so people can find me that way. I also like one little thing that I've just started doing from the very beginning is like a 5-minute workout that I put out every Monday. And
See
it's
those?
body
Yep.
weight. Yeah, it's body weight only. And especially as a lifestyle med physician, right? We're always trying to tell people like very small ways to start, right? And so everybody's got and everybody can do a workout that doesn't require any equipment. So can't use those as excuses. So every Monday I come out with a different workout that people can do and find that way. So I definitely have had people like be excited about that aspect as well. But still a work
For
in
sure.
progress for sure.
Yeah, no, and I love that, right? Because it's so important to get on social media. I tell everyone this, right? That if you're trying to build something, getting on social media is the first step to quote unquote media training, right? Because eventually, if
Yes.
you're going to become successful and you're going to become a household name or somebody in the community, the natural progression of that is to make more appearances, whether
Yeah.
you're writing a book, whether it's getting on podcasts like you are right now. That's getting in front of a camera and putting yourself out there is the ultimate form of vulnerability, self-expression, confidence, competence, and just being able to say, okay, you know what? I'm ready for the next step. And yeah, I'm a really big believer in everyone just creating reels, whatever it might be, and not really caring about so much of the opinions that come out there. So that's
Yeah.
awesome to see.
Yeah. And also just like not caring if things are totally perfect. Right. And I think
Right.
there's actually so much appreciation, especially like when I'm watching like somebody else's reel and I'm like, oh, they're like super chill. They're just like being themselves. And I'm like, yeah, that I can do. Right. Like I don't need to like have all of these studies memorized in my head and being like, yeah, well, according to this study from 2020, in every single reel. That's like one, not, yes, studies are really important, but that's also not how I talk on like a day-to-day basis. I want to be able to relate to people, right? And just be myself and
Yeah.
be approachable, right? And I think that's also so important. And that's like another big thing about outreach and being in the community is like be approachable, right? If people are just like cool with coming up to you, then that'll be like, oh, this is like probably a provider that I can trust with my care and like somebody that I can access and having a conversation with. But I think all of that is just so
Yeah.
important.
For sure. What a question I had that I also want to ask was, did you feel like there were certain certifications or qualifications that you needed from a medical standpoint? Did you feel like you needed that board certified lifestyle medicine before starting your practice? Or were there any type of communication certifications or business certificate, like whatever it might be? Did you feel like you needed to get to a certain threshold before you could say, okay, I'm ready?
Didn't I did the lifestyle when I was at my first job. I was on maternity leave and I like have been thinking about different certifications to get that would just like complement my practice of things that I was already doing. So I didn't necessarily need the lifestyle, but I thought that actually having the certification would be really helpful and also just make me more confident in everything that I was already telling people. But now I'm like, okay, yeah, this is actually like for real. And now I have all the evidence to support it. But no, since then, I have not gotten anything different. I just practice with the certifications that I have. And probably something in business or communications would probably be helpful, but certainly have not done them yet.
What are, let's talk about challenges. I'm, one thing that comes to mind is, so when it comes to providing care, any interventional procedures, you've got access to ultrasound. I know you've done some PRP in
Mhm.
clinic as well. But a lot of times, being a musculoskeletal expert, you need advanced imaging. MRI is the most common one that we'll use for any soft tissue injury. That I don't imagine you have an MRI machine sitting in your office.
Nope.
So, how do you navigate that process where you now need to order imaging that patients might be able to use their insurance, considering they're coming to you out of network? Is that something that people need to be considerate about? How do
Yeah.
they go about that?
Yeah, that's a great question. I tell patients that anything that is done externally out of my office, whether that's x-rays, whether that's MRI, whether that's blood work, so I do get blood work on my lifestyle patients, that can all be done with their insurance. And I think that telling them that up front, they're appreciative of that because they're like, okay, how much, what are all of my costs out of pocket going to be? And I think they do appreciate that. X-rays obviously are super easy. You don't need prior auths for that. Same thing with blood work. And I do have accounts with all the different big labs and things like that. I think MRIs was the biggest question that I had. And literally it wasn't until I ordered my first MRI on a patient and I'm like, huh, what's the process for this? Because literally everywhere else you are, you're like, okay, send it to prior auth team and you guys do your magic and then come back with your authorization number and tell the patient they're good to go. And I was like, I don't have any of those people anymore. And so I like quickly sent an email to another sports doc who has been my mentor also. And I was like, how do I get MRIs done? And he was like, either like you tell them they can pay out of pocket and like pretty much probably get the MRI next day, or some facilities will do prior auths for you. And that was like the best news ever. And so I called all of my local radiology facilities. I got all of their out of pocket costs for different images that I would typically order. So mostly like extremity MRIs. But I found out that one of the places does have its own prior auth team. So if I send them the specific paperwork. So, the specific codes, the script, the office note, everything that they need. they do the prior auth for you. And like, obviously it works in their favor too, because then patients are going to their facility, but it makes my life so much easier because now I have nothing to do with insurance and I just send them what they need and they will do it. And then they'll come back and be like, yeah, this was authorized. Tell the patient they can schedule. So that was like a really nice tidbit that I found out.
That's very cool.
Yes, super cool.
I thought you were going to tell us that you learned how to get on Availity and put these
Nah.
codes in and do all that stuff. And I was like, that sounds like a nightmare.
Nah.
Do you, to your point about that one facility that is actually reducing the friction.
Yes.
It's brilliant on their part because
Brilliant.
clinicians such as you might be more likely to refer to them to
100%.
make that process easier. Of course, as long as the patient can go to that facility and their insurance allows them to do that. But I'm curious, give me a ballpark of what like a shoulder MRI or knee MRI costs. I never thought about just calling facilities and just be like, hey, give me the price, give me the actual price for somebody without insurance.
It's usually, and it depends, like if you're doing like MRI shoulder versus like MR orthogram. I
Just
think like your
non-con.
non-contrast, probably for 500, something in that range. So it's money, right? Like it's definitely a significant out-of-pocket cost. That being said, like some patients will do that anyways if they're getting a lot of pushback and like claims just keep getting denied. They'll be like, I just want the MRI. I will pay out of pocket for it and get it next day. But that I feel is the minority.
I think though, and correct me if I'm wrong here, in order for them to be like, if a person has insurance and MRI is a covered test on their insurance and they're going to a facility that is also covered, until that MRI is denied, they cannot choose to pay for it out of pocket, right?
I don't
know. We might want to look this up because I know that certainly ends up being the case for medications. Because if you go to like CVS or something and they're like, oh yeah, we have to run it through insurance. And I'm like, no, I just want it now. I'll pay with my GoodRx coupon. They're like, sorry, we know you have insurance, so we can't do it. And I'm like, you're killing me, CVS. And we're gonna have to figure that out, and we'll put it in the show notes to look into that. But I thought that maybe that might be the case for imaging as well. I could be wrong.
Yeah, I don't know. I've definitely had patients that like it kept getting denied and the process was just taking forever. And the guy called the radiology facility and was like, I'm going to pay out of pocket, and he got it done.
Well, that's what I mean. Once the insurance says we'll not pay for it, then you can.
Right. So you're saying if it's still in the process and
correct. Yeah, because you don't know. And so like a lot of times, like the facility might say, hey, we have to first get a denial from your insurance before we allow you to pay for it. But yeah, interesting. You can always look that up. Cool. What any other challenges that you've experienced? Seems like that one was not too difficult. You were able to navigate that. That's pretty cool. Anything else that people should be thinking about ahead as they're looking on embarking this journey of DSC?
There's lots of challenges.
The top 2 or 3 that come to mind that you're like, yeah, this is a real process that I had to spend a lot of energy working through and learning about.
I think just like being a business owner. I think like the business aspect is like a lot to learn and a lot to grasp when, as most of us, like as physicians, we are not trained in this stuff at all. And so I think learning that and translating that into being a business owner and hopefully a successful business owner is challenging. And so I think that again just comes down to finding your resources and talking to people and reading and podcasts and as much as you can do. That was obviously a challenge for me just based on my background / lack of business background. And like same thing with sales, right? Like we are not trained to be salespeople, but we have to learn how to pitch what we do to market successfully and to attract patients.
Yeah, certainly. My hope is I know a lot of us have been advocates for implementing lifestyle medicine curriculum into residency, or not only residency, but actually medical training. But I think these concepts of finance and business, imagine the better, like how much better clinicians would be if we could take out memorizing just a ton of nonsense biochemistry and some of these obscure diagnoses. And I always go back to renal tube acetosis. I'm sorry, Darsh. And that always comes back to mind because RTA is something like you have to know type 1.
Oh gosh.
Stuff that you never ever need.
Oh my gosh.
It would just be so much better. And As we just alluded to earlier, I think the transition to direct care model, it's becoming more and more prevalent.
Yeah.
And I'm going to later ask you when you look in your crystal ball, what you think the next 5 to 10 years will bring. But especially over the last year, how crazy, like how much of a microscope the healthcare model has been, it's been very scary. So yeah, that would go a long way for helping physicians feel like they have their autonomy and
Yeah.
maybe more career satisfaction. We were talking earlier about, or at least I had mentioned that one thing that was concerning for me was the perception of my colleagues getting into that. Have you gotten any pushback from the surrounding community, any colleagues, anything like that?
No. Yeah, not really. And honestly, I am in like where I am in New Jersey is like a super saturated area of ortho groups. And so I feel in my surrounding towns, there are probably like 4 big ortho groups. And no, even the one that I came from, like really no pushback. I think they're just like, okay, they'll still send me all their ultrasound guided procedures because they don't have a non-op right now that does ultrasound guided procedures. And so they'll be like, yeah, this is the person that you got to go to. And I think that's pretty cool. But I really haven't had much pushback at all. I think people ask me like pricing. And then when I talk to them, they're like, oh, okay, that's not that bad. And I think they like expect a lot worse. I think they're going to expect me to be like, yeah, initial consult's $1,500. But I think once they actually hear the pricing and like how much time I'm spending with them, they're like, okay, yeah, that's not that bad. So I really luckily have not had a ton of pushback yet. Knock on wood.
You know what I've noted, Sarah, is I think the only cash pay thing that I'll offer in our practice is PRP, and pretty much everybody offers that. And it's interesting when you tell people that it's cash pay and you don't give them the price right up front, there's a suspense, there's a buildup. And then it just occurred to me as you mentioned that sometimes when I will finally give them the price, in full disclosure, we only charge $600. They'll be like, oh, okay, that's not that bad. And all of
Yes.
a sudden, I'll just see the sense of relief from them.
Yeah.
I was like, maybe I should have led with that. So have you find a good way to communicate pricing? I think yours actually is transparent on your website, right? I
Yeah,
thought I saw
so
that.
my website's like under a little bit of construction right now, but the pricing, yes, the pricing initially was up there, will go back up there. So I think that's another huge part of the DPC, DSC movement is the transparency of the pricing. And so patients can like look online or just talk to me. When patients call me and ask to make an appointment, literally the first thing I'm like, okay, I don't know, like, especially if they're getting referred from somewhere else. I'm like, I don't know if you know anything about my practice, but I am out of network and you'll see me, you'll pay for the visit up front. I tell them like what the pricing is. And then I say, then you will be provided an itemized receipt or a super bill at the end of your visit, which you can submit to insurance. And then I'm like, you'll never get a surprise bill from me. There's no copay. It's just, this is what it's going to cost you. And then you'll submit that for reimbursement. So
So
yeah, it's like
you
the
are the
first
one
thing that I
fielding the
talk
calls,
about.
though.
What's that?
Like
Yes, I
you're
am.
I love it.
I'm a one-man team.
I love it.
Yeah, so I'm receptionist and I don't know, handyman. I answer the emails, I do the follow-ups, I do the billing, whatever you need.
That's
For right
awesome. That's
now,
how you got
at
to start.
least.
Yeah, that's entrepreneur life, right? It's
Yeah, it is.
coming back to Hormozy, thinking that it's going to be the hardest thing that you thought, and it's going to be harder than you actually thought, right?
Yes. Yes,
Something.
for sure.
Let's look forward a little bit.
Yeah.
The next 10 years, how do you see direct specialty care evolving and maybe even shaping the future of musculoskeletal and sports medicine, lifestyle medicine too?
I think that this healthcare model is going to totally transform healthcare. And I think the more that the people who are doing it now can show others like what we're doing and how we're doing it and getting good outcomes and happy patients and happy providers, I think that more and more physicians are going to get into it, especially because they are burnt out, fed up with their traditional hospital or healthcare insurance system, that they want to be doing something else. Whether that is like so many already, right, have left clinical medicine to do pharma, to do other stuff, whereas others are like venturing out on their own to do this. And I think that lifestyle just integrates so well again with the musculoskeletal medicine approach. And that, like I was saying before, one body part like your knee or your shoulder pain, right? It's not just that, right? If you are eating an ultra processed diet, that is super inflammatory, like that's going to affect your joints. And if you have super high stress levels, you're probably not sleeping. And if you're not sleeping, then you're probably not going to be wanting to exercise and eat healthy the next day. And everything's related and it's just a really holistic approach. And I think, again, the more that we can show like different physicians that this approach works and patients, the more that like we explain this to them, it just makes sense, right? And that's what I loved about lifestyle medicine and why I picked lifestyle medicine out of everything else is it just made sense. Like it's such common sense stuff that so many people don't know. And it's like explaining these really little things like how to read a nutrition label, right? And how to shop the grocery store and find the right produce and like avoiding the center aisles because that's where stuff can sit for years, right? Like that stuff's not great for us. So if we can show them that like this stuff again affects their knee, their shoulder, their body, how they feel, how they're performing, I think that this is like the way of medicine and I think it's going to be awesome.
I totally agree. And I'll touch on my experience here a little bit. I was lucky enough to have a mentor in lifestyle medicine and functional medicine as a medical student. And so I was really able to shape my training and experiences towards that, do a podcast with Altamash here, network with people like you, and really have a good background and understanding of what else is out there. My fear is that the training system that we're all part of, this hierarchical system with oftentimes inefficiency and bureaucracy, keep you pigeonholed into just doing what you're trained in. But as a pre-med mentor, I have so many students reaching out to me and saying, hey, I'm really interested in holistic medicine and lifestyle medicine. So it seems like there's really this big push that people are starting to find out, probably through social media and from people like you who speak on it. What advice, though, would you give to medical students, residents that are interested in this type of medicine, but may not understand or know how to exactly keep their options open or know how to open up something like this once they become attendings?
Yeah, I think you can go to the source and aside from talking to physicians and other mentors that you know that have done similar, go to American College of Lifestyle Medicine, right? And there are so many resources there for medical students, residents, and luckily, as you said, like it is becoming a part of more like residency and medical school curriculums, which is so critical, right? Because if we when we were all in med school, nutrition lectures were like literally 5 hours and it was like nothing about nutrition. Like it was, I honestly don't even remember what it was about, but unless you had an interest or like a passion for it, like we all do, you're not looking into this stuff further, right? And that's why physicians, when they come out of med school, feel so not confident about talking to their patients about this. And if you're a physician and can't talk to your patient about this, we're not changing anything, right? And so if we can start this like at a younger age when we're in medical school and teach more people about it, because I think that so many more pre-meds and residencies are interested in this. So again, yeah, I think you can go to American College of Lifestyle Medicine. I think for residencies or med schools, you need some sort of like advocate at the top to be like, yeah, I'll start your guys' curriculum or I will help out or I can be a mentor for these med students who are interested, right? And if like you can be that person, you can now be an entryway for so many people to be like, this is awesome, right? And so I remember I had a lot of residents and med students rotating with me at my first job. And they would see how I practice and like what I talked about. And they're like, this is super cool. And I'd be like, yeah, the best. But I think, yeah, we need to start at med school, at residencies, and them from that age so that they can carry that on throughout their career. Because otherwise, we're just leaving it up to the individual to seek it out on their own.
And is there anything that you would go back and do differently, knowing what you know now?
I, Probably not. Probably learn that maybe like a little bit more about business. But I think if you had asked me, like when I was a resident or a fellow, or even in my first job, if I was going to be starting my own practice, I would have been like, absolutely not. Just the way that everything led me to where I was, this has been probably the best decision I've made ever. And that's awesome. So I think if we can show more people that this is something that's possible, then just got to do it.
Awesome. Sarah, this has been absolutely amazing. We've learned a lot. agree with you. You are somebody who brings us a ton of energy. I'll time it. We're approaching 10 p.m. Your kids sleep. I think my kid's asleep at this point. We should be asleep as
Yeah.
well.
Yeah.
But here you are with a lot of fire, and it's evident as it's coming through the screen because you're passionate about what it is that you're doing. And it seems like you have purpose. And I intentionally use those words because I think those are some of the most important things that we need to identify for ourselves as clinicians to take that autonomy back, make it more enjoyable, this experience, the reason we all got into it. Sarah, what is the most important thing that we haven't talked about that we should have talked about today?
I think we covered most of it. I would just say from like a physician standpoint, if you are looking or like considering changing your career in some way, shape, or form, and like you are not totally happy with where you are, like you don't have to settle, right? This is your life and you want to love what you are doing. And I think for so many of us in medicine, again, like we start going along this route, like we go into it for one reason and then like we end up at a job where we're like frustrated every day and we're not treating patients the way we want to. And there's just so many rules and like we don't have a ton of flexibility and there's so much else going on in life and like we're stressed. Like I think sometimes you have to take a step back and be like, what do I want out of this and what can I possibly do about that? I actually was listening to your guys' recent episode with Robin Tiger and like when she was talking about finding your why, like I just think that is so important. And like also reminded me of this poster I had in my room growing up with my like obviously favorite female athlete, Mia Hamm, my like total idol. And she had a quote that said, if you don't love what you do, you won't do it with much conviction or passion. And like, that's so true, right? And life is too short and like we just have to love what we do, right? And find that way, like, why did we go into medicine? What do we want to be doing? And like, at the end of the day, are you like super excited about what you're doing? And like, I have found that since I have started my own practice and like, I'm just treating patients the way that I want to and everything that I envision, it's amazing. And like seeing the outcomes from patients, seeing my relationships with patients and like the care that I can finally provide is just like awesome. And being part of this community and getting out there and having such a bigger network now, again, is like something I never dreamed of and has been one of the most rewarding pieces as well. Yeah, that's my advice. And just love what you do because life's too short otherwise.
Amazing. Where can our listeners go to learn more about your practice and even connect with you?
Yeah. So my practice is called CORE, like capital CORE, Sports Medicine and Lifestyle Medicine, which is in Princeton, New Jersey. So I've got a Facebook page. Obviously, my website's up there. My Instagram is at Dr. Sassy Weinstein. Sassy's nickname I go by, but I realized that I like pretty much introduce myself as Sassy now to everyone, like physical therapy places, and then they end up introducing me to everybody else as Dr. Sassy Weinstein. I'm like, there's probably not going to be a lot of confusion now. Like my Instagram is like Dr. Sarah Weinstein and everyone knows me as Dr. Sassy Weinstein. So literally as of 2 weeks ago, I was like, you know what? I am embracing it. Finally, I was like in the beginning part of my career, I was like, no, like I got to stay with a professional name, even though like literally everybody called me. And I'm like, you know what? This is me. If that's not cool with you, then whatever. You don't have to follow me, but that's who I am. And so, yes, at Dr.
Yeah.
Sassy Weinstein. Long story
Perfect.
short.
We'll put all your names. We'll
Perfect.
put all your names
Perfect.
in the show
Find me
notes.
wherever.
We might have to, we'll probably have to edit this wherever we call you Sarah. We'll replace it with Sassy too, but no, I'm just kidding. Before I ask you the last question that we ask all our guests, Sarah, Sassy, I just want to say thank you so much. Ditto what Altamar said. Your energy here has been fantastic. You provided us with so many highlight reels. I'm very excited about going back, creating these posts that we could do because there's just so many hits. Talking about your why, talking about the passion, and just really giving a lot of those resources out there. And so thank you for being vulnerable. Thank you for being authentic. You've got me excited about this once idea I also had about having my own practice and stuff. So you're giving a lot of people hope, I know. But with that being said, our last question that we ask everyone is, how do we put the health back into healthcare?
Yeah. Anyway, thank you guys so much for having me on. Also, just wanted to answer that. My goal in life is to pump people up and empower them to just be their best self. My little motto is move better, heal faster, and be your best self. So if I can be that person that
Mm,
pumps you up, whether like talking person to person or coaching you in a gym class, like I love that.
yeah.
But yeah, I think just going off what I have talked about in the past is if we can start to just provide like better value care and like enjoy and love what we're getting and finding what we're passionate about, I think we can literally like make healthcare the best that it's ever been. And I think the more people that get to do that and follow their passion and go back to why we're doing this and this, I think that we can absolutely put the health back in healthcare and make people just live their best and highest quality life yet and get people back to doing what they love too. I mean, that's like one of the biggest things I talk about with my patients is I want to make sure that you're doing what you love doing. Whether that is like going to your dance class or going bowling or playing with your grandkids and like, feeling comfortable carrying them. That's what I want. I want you to live the highest quality life possible. And so I think if we do that, then physicians are happy, patients are happy, and everybody's just happy again. Life goals.
Yeah. Love that. Absolutely. Absolutely. Thank you again.
Thank you guys so much. This was awesome.
Thank you, Sarah.